My name is Michael Betel. I'm the president and founder of the Fatty Liver Alliance. We raise awareness about the risk, causes, and complications of fatty liver disease and help those already diagnosed with MASLD and MASH by advocating for access to approved treatments and care. Today, I am very excited to welcome a first-time guest with us, Dr. Claude Sirlin, who is a professor of radiology at UC San Diego and a clinician scientist who specializes in liver imaging. He directs UC San Diego's liver imaging group, and he's the founder of the Liver Imaging Reporting and Data System, which is now used worldwide for imaging primary liver cancer. So Dr. Sirlin is here with us today to discuss his new paper, him and his colleagues, and it's called MASLD, What We Have Learned and Where We Need to Go, a Call to Action. We're going to talk about that for sure, the action part. Claude, first of all, I really loved how you summarized MASLD and MASH and clearly laid out the non-invasive array of options to help patients who have MASLD and MASH. So my first question for you is, why did you and your colleagues write this paper, and ideally, who are you trying to reach?
Well, Mike, thank you. We wrote this paper to increase awareness among radiologists of this condition and to provide a summary of some of the latest developments in our understanding of this condition. But finally, we concluded, as you alluded to, with a call to action to, the entire house of radiology, radiologists, technologists, nurse practitioners, industry, funding agencies, et cetera, to really get our act together and get involved in the management and further advancement of this condition.
You took the time in the paper to go through all of the different, and I don't know if this is even the correct way to say it, but the ultrasound type of scans, is that how you would say? Because you listed so many, from CT to MRI, PDF, all of those things. So I don't know, is there a name for the whole group of types of assessments that you guys would normally do
Well, I would say
or read?
broadly speaking, these different technologies fall under the rubric of quantitative imaging, and these quantitative imaging techniques measure so-called quantitative imaging biomarkers. These are measurements that we derive from tissue and tell us something about what's happening in the body non-invasively. With regard to the liver, we can measure the amount of fat in the liver, we can measure the stiffness in the liver, we can measure other properties in the liver. And it's wonderful that we have so many different techniques available to us. But ironically, that's also part of the problem because we have so many different
Yeah.
techniques, so many different options. Sometimes it's difficult to know exactly what to do and in what order.
I think too, when I say you, I always mean you and their co-authors, but what you said that there is not always an alignment even between companies in the US, for example, right? With the way that the output of some of the readings that you got.
Yeah, that's another challenge. So not
Yeah.
only do we have multiple different measurements, but we also have multiple different companies making the same measurements. Now, this is a really important point. Imagine that you're trying to weigh yourself on a scale, and imagine that your weight depended by 30 or 40% on the exact scale used to measure your weight. So that one day you weigh 150, the next day you get on a different scale from a different manufacturer, suddenly weigh 190, and then the day after that you weigh 115. So you would think that if we have quantitative imaging measures that are measuring the same exact thing, you'd get the same number regardless of who actually made that particular instrument. But that's not what we have in the year 2024. In the year 2024, we have multiple different manufacturers claiming to measure the same thing, but getting different results, sometimes by as much as 30 to 40 to 50% different.
That's crazy. I know, and I love saying this word, and I haven't used it in years, but sphygmomanometer.
Yes, yes, you
So
nailed it.
yeah. So the like on the blood pressure side, you would also the same thing. The physicians would expect to have something consistent, so that from one visit to the next, they can be consistent, or even one clinician to the next, right?
Right, we take it for granted that if you measure your weight on a scale, it doesn't really matter that much which scale you use. If you take your temperature, it doesn't really matter who made that thermometer. And I don't have the courage you had to pronounce that word. But
I
if you
practice.
measure your blood pressure with two different blood pressure cuffs, you should get about the same value. We take it for granted in other aspects of medicine, but that's not our current situation right now with some of the quantitative imaging techniques that we have.
Okay, I want to call something out specifically here. I'm going to read it. It's in your conclusion, actually, and I do think because A, it's in your title, a call to action. It's also in your conclusion that this was one of the purposes of this was to reach out to fellow radiologists, and as you said, all of the other people that are involved in that area. And you said, and I think this might be surprising for people to hear, but until now, radiologists have been excluded from some of the most important healthcare decisions related to MASLD. Since 2010, 30 clinical practice guidelines and consensus statements on MASLD have been released. Of the 459 unique authors who have contributed to these important documents, only 2 have been radiologists based on the published affiliations, and no radiology societies have participated. So it's like I couldn't believe it when I read it, and it's really pretty surprising.
Well, it is surprising and it's also quite disappointing in many ways. And it's unfortunate because a lot of these guidelines actually make recommendations about imaging, including how the imaging should be done, how it should be interpreted, and how it should be reported. And not to have radiologists involved in the making of these guidelines seems it seems like a really important missed opportunity because as radiologists, we're the ones who actually have the expertise in how these methods are used, how they're interpreted, how they're analyzed, how they're reported.
I think when we say multidisciplinary, what we normally think of is okay, we got, primary care, hepatology, cardiology, nephrology, but radiology isn't usually one of the other disciplines that is mentioned. So, as you said in the paper, demanding a seat at the table seems really appropriate as the world grows in this area. Massive dementia are not going away. I think there's a lot more awareness happening, and so seems to be a really good time for you to do what you're doing here.
Well, thank you. And again, so part of the call to action is to my own discipline, radiology societies to advocate for us to have a seat at the table. Part of the call to action is also to the other societies, the hepatology societies, the primary care societies, to invite us to join the seat at the table so that we can provide our perspective on our expertise.
Any other messages you'd like to share with colleagues? You just said it, but just in case, is there something that we can do, or maybe other patient advocate organizations can do, or other physicians can do to help you in your journey to be a bigger part of what's happening here?
Well, I think it needs to be a two-way street. So I think part of it is that we as radiologists perhaps need to be a little bit more aggressive about demanding a seat at the table. At the same time, it would be excellent if your organization and other organizations like yours could also suggest that radiologists have a seat at the table when some of these guidelines are made.
Well, you did invite me to be part of the group, right? The American
I did
Radiology
invite you to be
Association.
to a group that I'm running, yes. So I'm doing my part, at least
I,
I'm trying.
okay, so that's like one direction. Now we go the other way. But
Yeah,
at
yeah.
least this will give us an opportunity to, work together and to be able to cross-pollinate ideas. And I have a chance to represent my organization and other organizations at global meetings. And so, we can make sure that we mention what each of us are doing too, so that we can help raise awareness for this important point that you made.
Thank you, Mike. I really appreciate that.
Thank you. And thanks for today. And we'll do it again. We'll do another follow-up on your next paper while you're continuing to raise awareness. Thank you.
I hope so. I hope this is not my only visit. Thank
Yeah,
you.
that's it. Thank you.